welcome to Brant Life. My name's Dave Carroll. Great to have you here. This show is called Brant Life, and I'm the host of the show that we're on called Brant Life. This is the season finale of season 5 of Brant Life, and it is a doozy. We love talking with interesting people about interesting things, and if you haven't been on this year, you'll have to wait till next year, but we will be back. But we have a great show to be able to end the season. We have a couple of lovely folks from our friends over at Woodview. We have Amanda Detmar, who is the Woodville Mental Health and Autism Services Coordinator?
Manager.
Manager,
Yeah.
There we go. Coordinators, managers, working, that's good. And then we also have my friend Nikki Straza, who's here from Woodview. She is the PWLE. Nikki's always loved her acronym, so this doesn't surprise me. She's writing her acronym, Working Group Coordinator. So Nikki and Amanda, thanks so much for being here on Brant Life today.
Thanks for having us.
So maybe let's start, we're gonna do a couple of segments with you guys, so maybe let's start at the top. Tell me a little bit about Woodview and why Woodview is so important for our community.
Woodview is the lead agency in Brantford for mental health services. We've been around for many, many years. We have our agency is also in Hamilton and Burlington area. So providing mental health services to children and family age 0 to 18. Lots of different modalities, counseling, outreach, drop-in. We have multiple locations in Brantford. We have a youth hub in Harmony Square, our main office up on Park Road, and then we have our autism team that joined us in January of 2021, I believe, or 22. So yeah.
I was really excited when you guys opened up the hub in Harmony Square. I thought this is about the perfect spot to be. If you're gonna have a hub, this is the place for a hub. How is the hub gone? What's the dynamic of the hub?
They have so much fun down at the hub. I think one of the things that was really exciting is that our youth helped design it, picked out furniture, painted, really helped set it up as their space. And then just having partnerships in the community that come in and use the space as well, just to allow easier access for kids downtown that can't access us up in the North End. And
this might sound like an obvious question, Nikki, but why is Woodview so important to our community right now?
Well, mental health is a thing.
It's a thing, yes.
And you know, I think we all know the experience of having come through the pandemic, just the weight of life and mental health. Our students are struggling, and Woodview is positioned and has made some really important changes to be able to position ourselves to really serve our community in a more efficient and a more effective way. And we can be there to support mental health needs, anxiety, suicide, ideation, and all of those things that really weigh on our hearts, and sometimes we don't know that there's somebody there to talk to.
There are times when you bring up topics like you just brought up, that if you're sort of on the outside, but it affects everyone and everyone's family in so many different ways, but it can feel like you're a little bit helpless at times. You go, I don't know how to get inside somebody's brain and go, hey, I want to be able to help. But Amanda, you're talking today a little bit about the choice and partnership approach. Tell me a little bit about that.
Yeah, so about 2 years ago, we were, after receiving feedback from families that we work with, community partners, and our own staff, really wanted to look at a service transformation model for mental health services in Brantford. Our friends over at REACH shared a book with us called CAPA, which is the Choice and Partnership Approach. We read it, and it just fit perfectly with the feedback we had received and where we felt we wanted to go. So it's a service transformation tool, a system flow management tool that really met with Woodview's values as well. So CAPA is allowing us to further enhance our engagement with families, building that therapeutic alliance with them, getting families to access appointments in a more timely fashion. And then making sure that families and our youth are meeting with clinicians that really match with their needs and their strengths as well. So it's really helped us with just that family engagement piece, working closely with families. One of the things that we really liked about this model was instead of dictating to families what program or what service that they should go in, we're doing that in a more collaborative way and having a conversation with them and developing that plan together.
Partnerships are so important, so important. Without them, it really kind of thwarts any organization's ability to be able to offer the kind of service, because not just one group can do everything,
Exactly.
right? Okay, we got to take a break. We'll be right back. I want to talk a little bit more with both of you about some of the programming at Woodview. We'll be right back after this on Brant Life.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details. Looking for the best way to get the Major League Baseball games you want to watch? Rogers Super Sports Pack has you covered. With MLB Extra Innings, you'll have a premium ticket to out-of-market regular season games with all games available in HD. Don't miss the action from the games you want from both the American and National Leagues. MLB Extra Innings, part of the Super Sports Pack. For only $35.95 a month, Rogers customers get all this for one all-inclusive price. Order using your remote starting on channel 431 or visit Rogers.com today.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
And welcome back to Brant Life. We're talking about a really neat system of management, really, right? The choice and partnership approach. What's the benefit of families being able to choose help?
Yeah. So their first clinical point of contact with us is called a choice appointment or a choice session. That's an opportunity for children, youth to bring in their caregiver or support person, meet with a clinician, and it's really having a conversation about what is their view on what they're needing or what they're struggling with. Our clinicians do a really good job at having conversations and being really curious with families and really making sure that they understand what they're coming to the table with and how. And then by the end of that session, families are able to come up with a joint formulation or a plan together with a clinician about what can they use now, some tools to take away from that session to start practicing, and then what are the next steps. So co-developing that plan together.
Oh, that's so important. It's empowering.
Yes.
Yeah. Nikki, one of the things you're working on is something called People with Lived Experience. Tell me a bit about that.
So I have a role both at Woodview, and Woodview has a partnership with the Ontario Health Team, Brantford, Brant, Norfolk, Ontario Health Team. And it involves lived experience. That's why I'm there too. And what it is both Woodview and the Ontario Health Team really value the voice of lived experience, because we recognize that we can create all the programs in the world, but if we don't really understand the concerns and the challenges that our clients and our families are experiencing, we are going to create something they don't need. But when we come together and we bring that voice of lived experience into the creation process, just like the choice appointment, we now get to meet families where they're at and where those needs are. And the Ontario Health Team here in Brantford, Brant, and Norfolk wants to take that up a notch so that we're not just doing it at Woodview and really helping those clients, but we want to bring the voice of lived experience into the whole healthcare system in Brantford, Brant, and Norfolk. And my role is to develop a network of brilliant lived experience expertise that can consult with our 19 different partners in the Brantford, Brant, Norfolk, Ontario Health Team, so that the decisions that collective is making can make informed decisions based on the real needs and the real pain points of people in our community.
As both of you are talking, I'm thinking about the programming that we do here on Rogers TV called Kickback on Blue Monday, where people come in and talk about, their lived experience, and various different struggles with mental health, or family member struggles, or the kind of things or roadblocks that people hit. And it seems to me that it comes back to actually listening and not like preemptively just prescribing, and here I am, and now we will do this because such and such study says, but to be able to go, I'm listening to you. I want to involve you. I want to involve you to be part of the process, and I'm listening to the experience you've gone through. Is that right?
You've nailed it. That's exactly it. I think people in most contexts are frustrated and not feeling heard. And when we take a moment to listen, to hear, and then to adapt and make choices that are in alignment with what we've heard from our clients, we have meaningful supports that then are emerging out of that. And I love that Woodview is a champion for engagement at the Ontario Health Team level, and that the executives of our 19 partners are saying to our network of people with lived experience, we care about, we want your consulting, we want to hear your experience, and we want to make decisions based on that learning. And it's a remarkable experience to be a facilitator of those conversations, but it's really empowering to know that it's not just lip service, that people in places of decision making are listening, they're hearing, and our voices are making a difference. And I am just so excited to be a part of building a network where our voice really does matter.
So I've got about a minute and a half. Maybe you guys could share. Sometimes if people hear interviews like this, they go, that's great, these guys are doing a wonderful job, but what do I do to help? So maybe you can give me, in just a short amount of time, go, this is what people can do to not just help those in their area of family or influence or whatever, but how do people help the professionals and the different skilled, wonderful people at Woodview continue on this work and continue to develop it? How do people help?
So my first invitation would be, come and be a part of the Brantford Brant Norfolk Ontario Health Team, or if you've had services at Woodview, come and be a part of Woodview engagement, because that is where our voices come together. We talk with management about the things that are happening, and we gather those insights.
So that's a welcome thing for people.
Absolutely. We are wanting, especially with the network for the BBNOHT acronyms, we want 500 or 1,000 voices in our community that represent the diversity of our community to have a say. And so, yeah,
wow.
We can go to our website, bbnoht.ca, for more information.
The work you're doing is extraordinarily important, and it's not always easy, so I thank you both for what you're doing. Yeah.
Thanks for having us.
Hey, you're welcome. We'll be right back with more interesting people, more great stories right after this.